Since 2007, Israel's blockade of the Gaza Strip has taken a heavy toll on a population already suffering the effects of years of conflict. The economic consequences are considerable, so are the repercussions on health. During the daily power cuts, people resort to using generators, poor quality gas canisters and candles, and this is a frequent cause of serious domestic accidents, especially among women and children. Yusef is nearly 3. He received these burns when he was just a month old.
I lit a candle in the room where he was sleeping. My other son, who was 4 at the time, started playing with the candle and a bit of paper. Then suddenly the whole room went up in flames. I took him to Al-Shifa hospital and they kept him there for 35 days. They grafted skin from his leg onto his face. Afterwards, his face was deformed and he couldn't open his eyes.
At some point after the initial treatment, these highly disabling injuries often require reconstructive surgery. Although there is a functioning healthcare system in the Palestinian territories, access to specialized care is still very difficult. Very few patients manage to leave Gaza for surgery, and locally there are too few specialized surgeons to cope with the needs. So in July 2010, MSF launched a reconstructive surgery project in close collaboration with Nasser Hospital in the southern Gaza Strip city of Khan Yunis, with the aim of improving the treatment and care available to these patients. Particularly complicated cases like Yusef require highly specialized surgery. Today, he's going to undergo his second operation with MSF.
We're going to reconstruct the lip by grafting thick skin, what we call full thickness skin. And then we'll have to do the same for the eyes. The quality of the skin isn't good enough to do a Z-plasty. And then at some point, we'll probably have to do another graft for the whole nasal pyramid.
Burns patients represent more than 60% of patients treated on the programme. MSF sends surgical teams on short missions to Gaza several times a year, so successive teams have had a hand in Yusef's treatment.
When I first came here, they told me my child needed a comprehensive surgery program. Each new team that has come here has operated on my son and continued his treatment. At first, he couldn't open his mouth. I had to help him get a bit of food inside him. MSF operated on him and now he can feed himself. They've also operated on his nose so he can breathe better. And his fingers used to be all stiff. He couldn't pick anything up with his hands. They've really done a lot for him.
Yusef's operation is over. MSF's teams worked alongside Palestinian doctors and surgeons, as another key objective of this programme is to transfer skills to the local medical teams who are also victims of the Israeli blockade.
The embargo has had serious consequences for both our doctors and our patients. It's made it difficult for doctors to go abroad and get the experience they need. And it's stopped patients leaving Gaza for treatment. Quite frankly, these international medical teams who come to Gaza have been a great help to us.
Since this surgical project began in 2010, 490 patients have been operated on by MSF's teams and their colleagues from Nasser Hospital. MSF has been working in the Gaza Strip for more than 10 years. Over this period, in this fragile setting marked by frequent outbreaks of violence, our programmes have provided a range of activities to meet the needs of the population, including mental health care, physiotherapy and surgery. At the beginning of 2012, we added a specialised activity to our physiotherapy programme, the rehabilitation of hand functions. 24 hours after his operation, Eric, the maxillofacial surgeon, checks on Yusef. The operation went well. Yusef will be operated on again in the coming months. But in the meantime, he'll receive follow-up care at our post-operative clinic.